Good morning, dear guests. Thank you so much for joining us today, for those of you here in the room and those of you connected digitally, for the Headway 2023 Forum as we look toward a new roadmap in mental health. Headway 2023 is an initiative conceived of and launched in 2017 by the European House Ambrosetti in partnership with Angelini Pharma. The aim is to create a multidisciplinary platform for strategic reflection, analysis, dialogue and comparison among different European experiences. In 2021, the goal of Headway 2023 has been to build on the work started in 2017, sharing knowledge and know-how on how best to prevent, manage, diagnose and find solutions that lessen the burden of mental health disorders, not only in the healthcare sector, but in schools, workplaces and across society as a whole. Now, during today's event, we're going to be getting familiar with the results of the 2023 Headway Mental Health Index. This is a holistic and a multidimensional picture of mental health in Europe. It draws on myriad elements and interventions across health, welfare and education policies in Europe. And beyond that, we'll talk about that ever-present aspect in all of our lives this past year and a half, the pandemic. How has it impacted mental health? And how do we best respond to changing new and perhaps more complex mental health needs in schools, workplaces, and across society as a whole? I think we're all gathered here, be it physically or remotely, in the knowledge that mental health is a topic of crucial importance today. It's something that touches all of us in some way, something which transcends the boundaries of age, gender, of social status, and of background. And mental health problems have a major impact on families and individuals, and society as a whole, both economically and socially. Individuals' mental health is impacted by environmental factors like poverty, unemployment, poor education, or poor work conditions. So, to give us a better understanding of the picture across Europe, I think it's now time for me to pass over to the experts. But first of all, I'd just like to take this opportunity to remind you that all the documents from today's event can be downloaded. We have a slide coming up with a link for you. If you follow this link, you'll be able to download all of the documents from today's event. Now, here we go, sorry, just in case anyone missed it. So eventi.ambrosetti.eu/headway 2023. Now, allow me to introduce you, first of all, to Daniela Bianco. She is partner and head of the healthcare area at the European House Ambrosetti. So Daniela will give us some insights on the Headway 2023 Mental Health Index and its results. So Daniela, the floor is yours. Please just, all speakers, you can press your mic, turn it on and off before you and when after you speak. Thank you.
Thank you, Rosie, and good morning to everybody. Before going into the Mental Health Index, into the overview, I wanted to say thanks to all the experts that have been involved in these years in this initiative that, as you told, started 3 years ago in a different context, really, because we were without the pandemic and we were in the years where mental health issues were discussed mainly in the healthcare setting, in healthcare event and by this perspective, not very broad, because mental health is more broad, as we told in this report, as you can read. So what happened in these 2 years, in these 2 last years? We have prepared just a summary of the most important events and the relevant action that we can find in mental health. And I don't want to mention all of them, of course, but just to highlight the 2 last events. Yesterday, the 3rd Global Minister of Mental Health Summit finished in Paris. Maybe Dr. Starace will speak about that and will tell something what they decided. But 1 month ago, at the beginning of September, in Rome, there was the important G20 Health Summit, where mental health was an important part of the final declaration. And in the article number 15, sorry, but I cannot, okay. In the article, mental health and the needs for G20 to integrate and to increase the efforts on mental health were mentioned. It was very important also because for the first time in a G20, there was a side event on mental health, and was organized in Rome, and it was also important for other countries to have this great attention on mental health. Taking in consideration this changing scenario, so due to the pandemic, of course, mental health increased its importance and its attention. I wanted to show you another model that you can find in the report. We started from the health determinants model, and we consider how mental health can be seen in this model. So the index that we designed starts from the consideration that there are 3 key topics, key areas that are workplace, school, and society. Strongly impacting on mental health. And this is the reason why we have created this index. Sorry, but it's not so clear in the screen, I don't know why. But there is a framework, as you told, as Rosie told, a framework that is a multidimensional platform collecting main information and data coming from 2 clusters. A cluster that we have named mental health status of population, and the other one that is the responsiveness of the system to the mental health care, to the mental needs, sorry, in two items, in healthcare and in other places like school, workplaces, and society. So it's not important for measuring, but it's important for monitoring and for the comprehensive approach and holistic approach that we can provide with this index, because we really hope it can be a starting point for government and for institutions, not only healthcare institutions, to check and to control many indicators in different areas and to provide integrated policies for that. The last picture that I want to show you is just the general, the overview, the final overview that the index gives us. Of course, we are aware that not all the data were fully completed, not all the data were comparable. So we know that it's not important the single number of the index, but it's important to have the positioning. And if you look at this slide, you consider that by our analysis, the countries that have low responsiveness to the healthcare, in the healthcare system are the same countries with low responsiveness in other fields. So what does it mean? That in these homogeneous, different positioning of the countries, Europe has to work strongly on this dimension together to put all the countries up in this matrix, as you say. Thank you. Thank you really to all the experts, to all the working team that is led by Elisa Milani for the work they did in these months and these years. Thank you to Angelini for being a partner with us in this initiative. Thank you.
Thank you so much, Daniela. Now, as I mentioned, and as you mentioned, Headway 2023 is a joint initiative in partnership with Angelini Pharma. So I'd now like to pass over to Daniela Poggio, Global Communications and Patient Advocacy Executive Director at Angelini Pharma. So Daniela will give us an idea on Headway 2023's origin story and some of the ideas behind it. Daniela, please, you have the floor.
Thank you very much, and really, I'm really excited to be here after almost a year of working together with Daniela Bianco, and thanks really indeed to all the experts that participated with us. The origin, when I joined Angelini Pharma, the project was already in place, I must admit, but this is a project that immediately was very close to my heart, especially since after a few weeks we entered into the pandemic. And I'm not only a manager, I'm also a woman, I am a mom of 2 under 12, and I really went through all the difficulties that are so powerfully described in this report. And I was very shocked by some numbers, that 1 out of 3 kids who drop out of school have also a mental disorder. That we know, of course, the impact of the pandemic on women. And we see, again, this important information in this report. But also I was shocked by the fact that the 20% of working age population at some point report a kind of mental disorder, a kind of fatigue. And I think that also as an employer, this is very important to know that. So we simply just must to act now and really take advantage in a way of the pandemic and really put the mental health at the center of our agenda, because as some leaders already are understanding, the mental well-being of our citizens is a key cornerstone for a prosperous economy and a thriving society at large. So thank you again, and I really hope that this report is not only an insightful reading, informative reading, filled with data, but also a compass and a kind of wake-up call for everyone to act and to act even more. Thank you very much.
Thank you, Daniela, and thanks for reminding us that we're all here, you as experts, myself as chair, but also as human beings, you know, and that this is an issue that we feel day to day in our lives and those around us, and that we see very much. Now, today we're also joined by a member of the European Parliament, Dolores Montserrat. She joins us remotely. So Ms. Montserrat supports a whole variety of initiatives, including MEPs Against Cancer, the MEP Lung Health Group, the Allergy and Asthma Interest Group, and the Health First Europe. And beyond this, in the European Parliament, Ms. Montserrat has been focusing her work on mental health, the silent pandemic impacting large swathes of our population. So from Strasbourg, where the European Parliament currently has its plenary sitting, Ms. Montserrat joins us now remotely. Please, the floor is yours. Ms. Montserrat, do you hear us?
Perfect, because you had to activate my audio, and I was trying. First of all, I'm so sorry because I cannot be there with you. I would like to be and to share with you all this interesting panel during all the day. So good morning to all of you, and many thanks to European House, Ambrosetti and Angelini Pharma for having me here to open this very insightful event. But most of all, thank you very much to focus your efforts and resource on mental health. Since 2017, you start to build this new roadmap on mental health in Europe based on sharing knowledge and know how to prevent, diagnose, manage, and find solutions that reduce the burden of mental conditions. Previously in the healthcare sectors, and now with the Headway 2023 platform also in workplace, schools, and society in general. Today, ahead of the World Mental Health Day that will be next Sunday on October 10, we are launching the Mental Health Index developed to assess the quality of mental health in the 27 member states plus UK. I'm particularly glad that Italy and Spain play a big role in Headway 2023 with two multidisciplinary platforms involving experts of mental health across various sectors. Before the pandemic in Europe, 84 million people were living with mental health problems, a staggering number. The impact of the COVID-19 pandemic on mental health raised to 83 the rate of women, with a significant increase of depression versus 36% of men. Push 2 out of 3 young adults at risk of depression, affecting the 57% of healthcare professionals with symptoms of post-traumatic stress disorders. A mental health emergency is spreading across the European Union, a silent pandemic. We do not know where or when these numbers will stop growing. Children and adolescents are the most affected, with a severe impact on their psychological development. Spain has registered in the first quarter of 2021 twice as many child psychiatric emergencies as in the previous period, with cases of anxiety disorders, depression, self-harm, and adolescent suicide attempts. Suicide remains a major cause of premature death in Europe, with more than 50,000 deaths per year. In Spain, it has become the leading cause of death among young people aged 15 to 29 years. The pandemic has shown us more than ever how important our mental health is and how it is affected by the combination of social, economic, and environmental factors in our lives. There is no health without mental health. The boundaries of mental health go beyond age, gender, social status, and origin, and mental disorders have an important impact not only on individuals and their families, but also on society as a whole from both social and economic perspectives. Mental illness represents the second most disabling non-communicable disease. The total cost of mental health disorders in terms of loss of productivity and health and social care expenditure is estimated to exceed 600 billion euros in Europe, equal to 4% of the European GDP. Despite the critical importance of this impact, the Mental Health Index shows us that only up to 5% of the total government health expenditure is allocated to mental health across European countries. The Headway 23 Mental Health Index also shows that at European level, 70% of the employed population report mild to moderate forms of mental disorders. In addition, people with mental disorders receive a salary 58% lower. And there is also a gender gap. In Spain, for example, women with mental disorders receive 14% lower wage than men on equal terms. In relation to school dropouts, the index shows significant difference depending on the presence or not of programs to promote good mental health. Between 8 and 72 of dropouts are reported for young students with mental disorders. So mental health matters across policies, and to be really implemented, it needs a health in all policies approach: healthcare, education, employment, culture, finance, social protection. For the sake of the health of all our European citizens, especially the most vulnerable ones, we have the obligation to put mental health at the center of our European Union policy-making response. A proposal from the Commission for a joint action on mental health, you know that the name is Implemental, will be presented in the next weeks, funded via the previous third European Union Health Programme. So this action will support 21 countries to implement a community-based mental health system reform and a best practice aiming to prevent suicide. The new autonomous ambitious and funded as a never-before European Union Health Programme that we approved in the Parliament looks at a wide range of areas in which the Union, together with member states, can promote mental health. For example, targeted actions to address mental health in schools, support mental health professionals, as well as primary care doctors with a specific training aimed at recognize the first symptoms, improve awareness in the public agenda, and also among the cancer actions, mental health and psychological support along with patients empowerment will play a vital role. So last July, the Parliament approved the resolution that the name was the European Union Youth Public Health Strategy post-COVID-19, which recognize mental health as a fundamental human right and calls upon the elaboration of a European Action Plan on Mental Health 2021 to 2027. So we must invest to prevent the spreading of mental illness, to grow more high-quality mental care service in our national health care systems, to have better prepared and equipped professionals, and to foster social support for people with mental disorders. Sharing knowledge, best practices, data, and possible solutions on a European base, as the experience of Headway has enhanced, is essential to improve the capacities of all the actors involved in securing our mental health, and to build a new roadmap to support the drawing and application of new effective European Union mental health policies. So the new Union of Health that we are building from the Parliament, the Council, and the European Commission will have a mental health pillar that will allow us to face this challenge, crossing all the sectors from a health, economic, and social perspective, with collective responsibilities, especially towards the most vulnerable groups of the population. So thank you very much for your efforts, and the Parliament, it is here to work together and help us together to put this pillar and the mental health in the center of the health policies in all Europe. So thank you very much.
Thank you so much, Ms. That was Dolores Montserrat, member of the European Parliament and, of course, former health minister. Thank you for those fascinating insights. Now, from here, I'd like to move on to the impacts of the pandemic. So in 2021, the Headway 2023 initiative has borne witness to the legacies of the pandemic and its significant consequences on people's mental health. That's certainly something I've witnessed myself in my journalistic work. A Eurofound survey found that mental well-being dipped to record low levels after the onset of the pandemic. Now, let's get a better understanding of that with the author of that analysis. I'd like to cross over now to Mr. Massimiliano Mascherini, who's head of social policies at Eurofound. Mr. Mascherini joins us via video conference from Dublin. Mr. Mascherini, please take the floor. Do you hear us? You hear us. We don't hear you yet. Bear with us. These are the joys of the semi-digital event.
I think now I can talk.
Fantastic.
Great. Thanks a lot. And thanks a lot to Ambrosetti for the invitation to contribute to this important event and to give us the opportunity to present our data collected during the pandemic. I have prepared a presentation, so in case that it can be shown, it would be good. Yeah, great. Thanks a lot. So if we can, Massimiliano Mascherini, I'm the head of social policy at Eurofound. And if we can move to the next slide, we can see. Okay, the COVID-19 crisis. This is how we see it actually, like a modern Kerberos. Kerberos was the guardian of the Haid, the three-headed hound that was at the entrance of the Haid, and this is a bit like the COVID-19 pandemic is actually. It started as a health crisis in March 2020, and then it developed as an economic and a social crisis. And all these three different heads actually had hit different parts of the European population. But the health crisis also brought with that not just the physical disease, but also the mental health implications of all these situations. We can move to the next slide, actually, please. Because the COVID-19 pandemic and the lockdown measures that have been implemented in order to control it has generated a parallel epidemic of mental health. and whose effects actually are here to linger long after the pandemic has subsided. Basically, there are two implications of the pandemic on the mental health of Europeans. One was related to pandemic-related distress, like the fear of illness, actually, the fear of economic uncertainty. And then there are the results of the non-pharmaceutical interventions, like social isolation, like lockdowns, that has been implemented in order to control the pandemic. Now, if we can move to the next slide. In order to measure this impact, actually, Eurofound has launched a survey in March 2020 that was called a Living, Working, and COVID-19 survey. It was a survey, and we ran 3 waves of this survey: in spring 2020, in summer 2020, and in spring 2021. And overall, we had more than 100,000 responses. And most importantly, we have a panel of around 40,000 people that participated to the 3 waves. So it was important to follow actually how developed the impact on mental well-being of the pandemic. If we can move to the next slide, please. And here is what we found in terms of WHO mental well-being scale that we know measures actually mental well-being on the basis of positive feelings. And what we saw actually is that before the pandemic, in our previous survey that was called the European Quality of Life Survey in 2016, the average of the WHO mental well-being index was 64. At the beginning of the pandemic, in March 2020, it decreased to 49, so 15 point less. It increased again during the summer 2020 when society reopened temporarily. And then in March 2021, at the height of the 3rd wave of the pandemic, it decreased again, this time more, to 45. Actually. And we know that if a WHO index below 50 indicates the risk of mental depression. So if you can move to the next slide, please. We also checked different indicators, and these are, for example, feeling downhearted and depressed, feeling lonely, and feeling tense. And here we observe an exponential growth of these indicators in comparison to the previous, before the pandemic. Our European Quality of Life survey raised as 6% the share of Europeans that were at risk of depression or loneliness before the pandemic, and this grew to 25%, so 4 times more, and reached 31% in spring 2021, when we had the 3rd lockdown and countries went again on very long, I mean, we had the third wave and long lockdowns. Again, a feeling of tensions moved from 11% before the pandemic to 39% in spring 2021. Now, if we can move to the next slide, we can see that the impact on mental well-being was basically not not the same on everyone. In particular, what we see is that the impact on mental well-being, so on tension, loneliness, and depression, was higher among young people and among women, reaching its peak with among young women, basically. And this can be seen actually because in all the indicators, basically, women are at the top, and there is a decrease of the effect on through the age. So basically, the impact on mental well-being, actually, based on this evidence, but also other studies that we did, is not really driven by the fear of the pandemic, but more from economic uncertainty and the lockdown measures. So if you can move to the next slide, actually, now I will investigate basically young people, women, and then I will go briefly in the labor market, actually. So the case of young people, we know that historically and traditionally in scientific literature, if we see the mental well-being of young people, usually this is higher than mental well-being of older people. This was confirmed by several surveys. Well, what happened during the pandemic is the opposite. Young people had much lower level of mental well-being than older age groups. In particular, if we see on the right this graph, we saw that the effect on mental well-being was higher among the unemployed, among students having tertiary education and having a partners. On the other hand, reduce the impact of the pandemic on mental well-being, and in terms of school of non-pharmaceutical intervention, the most negative effect was recorded for school closures, actually, and this is the link with the student. So this is quite important because it shows how basically it reverted, and the young people were those who were hit the most. If we move to the next slide, actually, we'll focus on women, and especially on women with young children. Women and young children are the population that was mostly affected by the crisis in terms of mental well-being, in our opinion. This basically was due mainly, was due for several factors, but basically with the closure of shops, with the closure of economies and social distancing and lockdown, young mothers start to work from home, but together with the closure of schools, actually, these made the work-life conflicts exploded due to the unequal distribution of family responsibilities within the household. And we can see from this graph, actually, that young women with the children are those that recorded the highest level of tensions, the highest level of depressions, but also importantly, if we look at those on the feeling loneliness, of course, this is recorded the highest score in feeling loneliness. Feeling lonely is recorded by people without children, but if we see those with young children, we see that young women felt almost 3 times more likely to feel lonely in comparison to men with young children. And this should actually make us reflect on the support of men to women within the household. Now, if we move to the next slides, actually, I will conclude with the labor market. In terms of impact on labor market status, being part of the employment was a protection against mental well-being effect of the pandemic. Those who were excluded, those who were unemployed, recorded much less. 35 is the average level recorded in the WHO scale. This is very low, actually, but this incorporate all the uncertainty in terms of labor market participation and the financial hardship that people that were outside the labor market were actually more likely to experience. But if we go in the labor market, actually, and we can go to the next slide, we can see that the well-being, the mental well-being among the different sectors shows an interesting picture. Those who are working in healthcare actually recorded at the highest level of mental well-being during the pandemic, followed by public services, manufacturing, and then when we go to the sectors that were mostly affected by the pandemic, such retail and hospitality, workers in this area actually record a lower level of mental well-being, indicating that really economic uncertainty and uncertainty on labor market participation played a huge role in shaping the effect of the pandemic on mental well-being. Now, the last slide, please. This is the effect of, but please go to the next one, so otherwise it'll be too long. And so the conclusion, actually, I said at the beginning that we saw the COVID-19 pandemic as a Kerberos, actually. This is a three-headed hound, because the 3 phases of the crisis, the health, the economic, and the social, were biting different groups of the population. Now, while we put rightly while we put at the center, of course, the protection of the most vulnerable against the virus, government social partners actually should work like a modern Heracles. Heracles was the Greek hero that basically defeated Kerberos. And how Heracles did? He didn't fight one phase of this monster at time, but basically he took the throat of Kerberos. So basically facing the three heads of the crisis all at the same time by, if we can use this metaphor, using an holistic approach that were addressing all the different phases of the crisis, and then addressing and protecting all the different social demographic group of our society, and then protecting also the mental implication of the pandemic. So it's all from Dublin, and if there are questions, I'm happy to answer. Thanks a lot.
Thank you so much. That was Massimiliano Mascherini, Head of Social Policies at Eurofound. Thanks for that, ending on a positive note there after some very sobering insights. So we've heard some of the initial results of the Headway 2023 Mental Health Index, but we have also here with us two advisors to the initiative who can talk us through some of the details of the performance indicators analysed. So I'm honoured to be joined first by Professor Celso Arango, who will give us an overview of different populations' mental health status and how responsive systems are to healthcare needs. Professor Arango is president of the Spanish Psychiatric Association, and he joins us here in Brussels today. Professor, it's over to you for 10 minutes.
Thank you very much, Chairwoman, and good morning to everyone. I guess that every time a group of experts like the one sitting here today get together to discuss a specific topic, they think that their topic is of the utmost importance, right? It's probably a conflict of interest or a kind of bias. What I'm not that certain is that any of those topics will directly affect 1 in 5 of European citizens, and indirectly almost all of them, because if it's not me or you, Ms. Chairwoman, that have a mental disorder, it will be one of our first-degree relatives or our best friends. So I really do think that we need to invest more time, energy, and efforts into this issue that, as I will mention, is crucial for the future of the European citizens. Because this is the data, like some countries going to 20,000 out of 100,000, which means 1 in 5. And despite all these burden, impact, high incidence and prevalence, the reality is that consistently and over the years, it doesn't matter what European country, the mental disorders have not attracted or gained as much attention and investment as other physical disorders that I'm not going to say they're important, but they usually affect less people and have a less impact in the life of these citizens. Let me see if I can move the slides forward. Yes. So this is data that Dolores Montserrat already talked about. And what is relevant here is that overall CNS diseases cost to the European Union more than 93 billion euros per year. And they're the second most common disabling and not communicable diseases and represent 15% of the European burden of disability. So it's not the personal, human, emotional tragedy, it's also the cost that comes with it and the amount of money, right, that goes with these mental disorders. Something that you will notice if you look at the figures is that it doesn't matter what what we're discussing, there will be huge discrepancies, a huge heterogeneity in how this affects different countries within Europe. Okay, so there is this false belief that mental disorders do not kill people. And that's absolutely false. It's not only that people with autism and with other severe mental illnesses live between 10 or 15 years less than the general population, people with schizophrenia, people with bipolar disorders, but these conditions kill more than 165,000 people per year in Europe. And it's not only suicide, which is extremely relevant, it's also many other things that are associated with mental disorders. And in this slide, you have the standardized death rate for mental and behavioral disorders per country. You see United Kingdom rating first. And you also have the suicide rate by age group. And we also heard from previous speakers that this is a problem that it has raised with the pandemic. And in many of our European countries, it is the first or second cause of death among adolescents. So, again, I don't believe we're paying enough attention. The WHO reminded us not long ago that there are only 38 countries in the world that have a national plan for suicide prevention. And that's something that, I believe that all European countries should have. Alcohol abuse, substance use disorder is also very prevalent in most EU countries, including alcohol, tobacco, and illegal drugs. 1 in 6 people will use illegal drugs in Europe, and there you have the different countries with different colors, and red meaning more people using or abusing drugs. And again, huge discrepancies, like you have Greece with more than 30% of population smoking as compared to Sweden, where only 10% of them smoke. So these discrepancies tell us something, and it tell us that the countries that are doing worse, there is nothing predetermined, and they could be doing better, because if there is a country, schizophrenia or bipolar or autism or depression is not different in one country to the other. So different countries have a different way to approach things, and of course, as we will see later, have a different investment in how much they put into mental health. And that for sure translates into better results in some countries as compared to others. If there's something we have learned in the last decades of mental health research, is that we know much more now about risk factors. And we know that some of these risk factors are preventable and some are not, like genetics. What is the DNA? So we cannot do yet gene therapy, but there are many risk factors that we can prevent. Some of them are here, which is bullying and sexual abuse. And we should, know that there is a close and direct relationship between being abused in any form of, school abuse, bullying, sexual abuse, physical abuse, especially in childhood. And there are many more kids that are abused and bullied that we may think. And in some reports, it's 1 in 3, 1 in 4. And we should also know that if you're different from the rest, you're a target. So we have a vicious circle in which people that are already vulnerable are more likely to be bullied, are more likely to be abused, and therefore are more likely to end up with a mental disorder. That's something that I think is very relevant. We in psychiatry, we in mental health, do not have fancy infrastructure, fancy machines, right, that will cure or diagnose mental disorders. The best we have is manpower, is psychiatrists, clinical psychologists, nurses, and that's where we have to invest. And as you can see here, again, there are huge differences between countries. You have the Netherlands, or almost 300 people per 100,000 inhabitants devoted to mental health services, as compared to other countries that have less than 20 or 25. So it is clear that there is a lack of people, human resources, working in this field. And that is even more the case for childhood and adolescent mental health. So we really need more child and adolescent psychiatrists, clinical psychologists, and nurses that work in this field. I'm almost finishing. What is the quality score for each one of the countries? It's there, goes from 10 to 1. Again, reflecting the huge differences. And I guess most of this is driven by how different countries prioritize mental health. So if you look at the percentage of the total healthcare expenditure that goes into mental health, the average for Europe is around 5.5. We have some, especially Western Northern countries that devote more than 10% of the total expenditure for healthcare into mental health care, and then we have some countries that only devote 1 or 2%. And it's that, I think, that prioritization that really it drives most of the differences that we see between countries. So just to summarize, there are the picture is very uneven in Europe in terms of availability, accessibility, and quality of services. We definitely need to increase the amount of data. So any decision that is taken is based on evidence-based, right, and numbers that we can collect from the different countries. We need to, and you mentioned this before, that we need a holistic approach. We need to not only to treat the body, we need to treat the psychosocial aspects of the human being that has a mental disorder, reducing the stigma and treating all the conditions, including psychosocial conditions that increase mental health. We need more funding and more investment, and we need this is a transversal issue, transversal problem, so we need the coordination of many different stakeholders. And finally, we need to pinpoint and highlight some areas in which there are special problems, like the transition from adolescence, and we heard that the pandemic is affecting adolescents more than any other age segment, into adulthood. So many of our patients are not lost in the transition from going to services that deal with childhood mental health into adult mental health. And with this, I will conclude my report. Thank you very much.
Thank you so much, Professor. I really like that point. You said that these wide divergences can actually be a source of optimism, because it shows that nothing is predetermined and that we can improve things. Now, Professor, you also mentioned there that we need to look at mental health within the whole social context, and I believe that's what our next expert is going to pick up on. So I'd like to introduce you now to Dr. Fabrizio Starace. He's president of the Italian Society of Psychiatric Epidemiology. Dr. Starace is going to talk to us a bit about how mental health is sometimes seen too much in a health perspective, but in fact it's something that goes across all of society, that cuts across all parts of public life. Dr. Starace, the floor is over to you for 10 minutes. Thank you so much.
Thank you. We all know that mental well-being is deeply impacted by social determinants. Given these well-studied, analyzed, reported links between mental health and the social, economic, environmental determinants of health, only an integrated cross-sectoral response, including health, education, research, welfare, housing, labor market, can deal with the problem. However, at present time, no comprehensive health and social index is available to inform decisions, political decisions, replicating in some way the fragmentation of initiatives that we criticize between social care and health care, between hospital and community, between the public and private sector, between academic knowledge and practical expertise. So here I'll try to summarize the results of this mental health index, one of the few attempts to include in a comprehensive index not only health-related indicators, but also elements of this so wide world of that we define the social determinants of health. Let's start from something that gives us a much wider view of the subject. The total cost has been already said before. The total cost of mental health disorders sum up to more than 600 billion euro across Europe, and is composed by not only direct spending on healthcare, which is part of this sum, but spending on social security and in indirect costs from the labor market due to reduced productivity and so on. The evidence shows that a gap between 20 and 60% does exist between, for instance, employment rates of people with depression and people without depression. Moreover, those who are employed have lower salaries, are unsatisfied with their job, and report to feel not respected. Two phenomena are observed in this population: presenteeism and absenteeism. Presenteeism is observed in 3 out of 4 workers who have not taken sick leave despite their mental ill health. Absenteeism is given by the sickness absence and early retirement for mental health problems. But this is not working. Can we find a way to convince these slides to go? Okay, the next one, please. When looking at the responsiveness to the needs of individuals, we see a wide variety of expenditure for mental health disability benefits. Again, the range is between less than 100 euros to more than 800 euros, with an inverse relationship between expenditure and perception of support. The highest expenditure gives a direct relationship between this expenditure and the perception. But if we look at the variability in responsiveness to the needs of individuals in a global view, which is best reported in this slide, we see that awareness programs, social inclusion programs, cooperation with unemployment services, attention to social determinants given in policy papers and so on varies so much in European countries. The green color gives us the idea of something that has been accomplished, but look at how many red colors and yellow are in this slide. Let's go to another crucial place where pupils, adolescents develop not only educational curriculum, but also their social identity. We know that 50% of mental disorders debut before the age of 15. But we observe also that 35% of young students report at least one of the common mental disorders. But the most important thing is that almost 1 in 3 children who drop out the school have also a mental disorder. And again, how European countries deal with the needs of individuals with mental disorders in schools and of their families. Again, much variability can be observed in awareness programs, guidelines, dissemination and application, consulting activities to consult children and families, and training programs. So, in conclusion, we need to adapt changes in mental health policies. Mental health significantly impacts on all economic and social sectors of society. Mental health strategies and policies must therefore embody all determinants of mental health and use the approach of mental health in all policies, as recently confirmed in the Paris summit, International Summit on Mental Health, and 1 month ago in the G20 summit again on mental health. Mental health services need to be able to quickly adapt to changing circumstances. such as those determined by the COVID pandemic. This is only possible through delivering support in community-based settings and across all sectors, workplaces, schools, and society in general. Let me conclude by saying what I addressed to G20 countries opening the session we held in Rome 1 month ago. I underlined that in mental health, we have no vaccine to avoid sufferings. So together with clinical approach at individual level, we are asked to work each and every day on those aspects of life that are associated or causally related to mental illness. Since nothing can be changed unless properly assessed and evaluated, we welcome the introduction of the Headway Mental Health Index as a powerful tool to lever the necessary reforms. Thank you.
Thank you so much, Dr. Starace. And to all of our speakers until now, what I think we've seen so far and what we've heard from our speakers is how mental health impacts all economic and social sectors of society. So that means mental health strategies and policies should address all determinants of mental health, and that other policy areas should factor mental health in. Meanwhile, with the pandemic, we've seen that our mental health services must be able to adapt quickly so they can continue to deliver even in times of emergency. Now, I'd like to move on to our roundtable on how to respond to new mental health needs in workplaces, schools, and society, very much with that in mind. And for that, I'm joined now by a wonderful panel of speakers. And first of all, I'd like to introduce you to Marie-Cécile Rouillon, who is a policy officer at the European Commission's Directorate General for Employment, Social Affairs and Inclusion. And she works in the Disability and Inclusion Unit. So, Marie-Cécile, could you tell us a bit more about how mental health is interplaying with disability and about what kind of trends we're seeing in exclusion? And beyond that, give us something to look forward to. What is the Commission doing to try and make this better? Thank you.
Thank you very much, and to all speakers, very instructive. And well, last Tuesday, there was a release from the UNICEF, a report that was kind of scary, and that said that there are 9 million of adolescents in Europe, aged 10 to 19-year-old, who live in Europe with a mental disorder. And so that was ahead of the World Mental Health Day on Sunday, as you know. A lot of figures and very interesting data were given, and so showing that, even before the crisis in 2018, there were already 84 million of people affected, and that was exacerbated during the COVID crisis, with a growing burden of mental ill health, higher rates of stress, anxiety, depression, and as it was said, with young people, older people, and with people with lower income also being at higher risk. And so the COVID crisis deeply affected the most vulnerable persons, and that was also mentioned in terms of risk factors for mental health disorders that were also at stake. Talking about financial insecurity, unemployment, fear, limited social contacts. And on the other side, in terms of social connection, employment, educational engagement, daily routine, and access to health services. Thanks to Eurofond and so it's very interesting to hear about this index. We will look at this into details. But indeed, interesting that also Eurofond stressed this dimension that groups, also people with disabilities, and notably people with intellectual and mental disabilities. There was an interesting OECD report that said that more than 60% of countries worldwide reported disruptions in mental health services in the second quarter of 2020. So it's kind of double punishment, so double pen. So, okay. And so what is feasible to do at EU level in that context that is really far-reaching, as you mentioned? So something to look for in the future. So one of the priorities of the current Commission is to create a union of equality in all its sense, meaning that everyone can assert their rights and live in freedom and equality with others. In that context, in March 2021, the Commission put on the table a new strategy for the rights of persons with disabilities, and covering all kinds of disabilities, including those with invisible impairments for the next decade, so that's strategy for 21-30. And it's basically the support that the EU could give to implement the United Convention for the Rights of Persons with Disabilities. And it's interesting, I mean, today is about mental health, but to really see that it's a kind of global compass as well that we have and that member states have signed, so in order to see also what could be done. Because it's important also to see the intersectionality approach of this strategy. And human rights perspective is really essential in the design, implementation, and evaluation of policies and programs that address mental health and psychosocial well-being. And it was also mentioned that the issue is really to understand the varying needs of persons with intellectual disabilities and mental health disorders, and that require a global solution to ensure ultimately that they could participate in society on equal basis with others. That's the meaning of this rights-based approach. So this implies removing the barriers, including in terms of attitude, inclusion in education, employment, access to society, services, health, and care systems. As was mentioned, it's indeed cross-cutting. So concretely, what do we have in the strategy that could also be of help in that context? For instance, in 2022, the Commission will present an employment package to improve the labor market outcomes of persons with disabilities. It will provide guidances, exchange of best practices, and notably in terms of combating stereotypes that are quite strong, also very strong, and especially for people who are affected by mental disorders. Also, it was mentioned that the housing conditions, persons with disabilities and notably intellectual impairments and mental health problems must also be the protagonist of their own life within the community. So in line, once again, with the UN Convention for the Rights of Persons with Disabilities, the Commission promotes the independent living through quality, person-centered, community-based services, support to families, and personal assistance, which are also really part of the package that will be looked at in terms of also studies, guidances on which we will also keep working. And in this cross-sectorial dimension, the disability strategy is also a mean that has been put on the table to mainstream disability across EU policies in terms of accessibility, in terms of equal rights, the right to move, the right to vote, discrimination in the access to justice, education, health, culture, sport, safety, and also, but that's another dimension globally. So that's as regards the disability strategy. Then, as you mentioned, I'm working in DG Employment. However, we work in close relation with also a colleague from the Directorate General for Health, and notably on some parts of the strategy. So here, I would just quote what they say, but or what they do, but it's not something on which I'm directly working, but that could be of interest for the debate. For instance, it's important to see that the challenges of the COVID pandemic are really complex, and so DG Santé has set up a dedicated network space It's called Health Policy Platform that is coordinated with the Mental Health Europe. So it's a platform for exchanging best practices and see how the practitioners also could exchange. A second point is so steering group on health, promotion, disease prevention, management of non-communicable diseases. So basically an expert group of representative of member states who is also put mental health in terms as high in the agenda. Also in terms of funding, under the health program, annual work plan, exchange of good practices, with some projects focusing on prevention of depression, innovating mental health system reform, suicide prevention. And there is also a call under the annual work program on the best practices to tackle mental health challenges as a consequence of the COVID crisis. So just to give you a picture of what could be also used in terms of toolbox from what exists at the EU level. And to conclude, I really call for cooperation and indeed complex trauma, barriers and vulnerabilities at the heart of the society affect mental health. And it's really essential to understand this complexity. Therefore, we need all efforts of member states and also at any level in daily life. And today is also to listen to the voice of civil society, stakeholders, experts, scientists, families. It's with all of those efforts that ultimately we could also bring persons with mental disorders at the heart of the attention. Because ultimately it's really to improve the life of person for which we care, who could be members of our families, friends, at work, at school, and ultimately within what we wish for, meaning an inclusive equality union. Thank you, and looking forward to listening to you.
Thank you so much. That was Marie-Cécile Rouillon, Policy Officer at the European Commission and the Director General for Employment, Social Inclusion. So you mentioned that you were here to hear other voices, so let's now hear from one of those voices that's not heard enough. I'd like to now pass over to John Saunders of Euphemy, supporting families affected by mental ill health. Behind all of these cases, all of these figures we're talking about today, there are so much more. These are problems that can really shake the core of a family and place major strain on relationships and caregivers. What better support could we offer there, John? Please, can you talk to that point?
Thank you very much, Chair, and good morning. Delighted to be with you. And just to follow on what you're saying, Chair, we have heard lots of very valuable information this morning. I don't think any of the information is new to us, in the sense that we have spent many years working in mental health care services and are very familiar with the patterns that we're hearing. My role is to, I suppose, refer to what we've heard and to the world of mental health from a very unique perspective, and that is the perspective of families. And the context of that is that I am representing Euphemy, which is a European-wide organization of national organizations that support families in the arena of mental health. We represent 38 members across 27 countries at the moment in Europe, not only in the EU, but also beyond the EU. And I suppose the unique perspective is in the context of how mental health services have developed across Europe over the last 40, 50 years. We all know the history of breaking down the old institutions and the old asylums and the move towards community-based mental health care services, which I think we all support. It's true that the stage of progress across Europe varies enormously, from very well-developed community services to much poorer developed services, and in some cases, very poor services. The context of that for us is that community mental health care is usually synonymous with family care. In other words, if you look at the amount of time that people with mental health problems engage with mental health professionals directly, it's quite low. Obviously, people may be in residential care for some period of time, may attend clinics and day services and so on, but by and large, they are out in the ordinary community, which should be quite correct, And for many, they are living in a family situation, and in that context, a family carer is the person who provides a lot of direct support. In some cases, there isn't a family connection, and we all know that. Sometimes it's not appropriate. We all know that in very severe mental ill health, family relationships break down very quickly, and social relationships break down, and individuals often find themselves quite isolated in the community. We're working in the context that family carers have an important role as partners in the care process. And in fact, a survey that we're launching tomorrow to support World Mental Health Day shows, among other things, that on average, a family carer will spend about 45 hours per week giving direct care to people, usually with very severe mental ill health. And again, the type of families that we support usually support people with diagnoses of psychosis, schizophrenia, bipolar disorder, severe depression, and so on. So that's the context that we are working in. In terms of your family's position, as I've said, for us, community care actually is synonymous with family care, and that very often mental health services are developed without including a formal structure for family members to be supported and to be engaged with. We believe very firmly that the causes of mental ill health are both biological, social, and indeed psychological, and we've heard that this morning from other people as well. In that context, there's a huge amount of work that can be done to support people from a psychological perspective and a social perspective, as well as direct medical intervention if that's required. We also believe firmly that the quality of recovery that one would hope to achieve in mental health care is positively influenced by having a very strong, appropriate family support system. And we know that anecdotally, and we know by research, that if a person has a very strong, appropriate adult to support him or her, recovery is somewhat better in terms of the quality and the long-term outcome. So the context of those three statements for us is that mental health is a political issue. I don't mean political in the sense of political parties. I mean political in the sense that it must be core to government policy to ensure that when you're developing mental health care services, that you include not only the voice and the wishes of the person using the services, but also the family member as appropriate, because the family member can contribute a huge amount to the process of recovery. Looking at the data that Headway 23 has produced, and listening to some of the presentation this morning, I suppose there are a number of things that stood out for us as a family support organisation. It has been mentioned already this morning, the issue of absenteeism and presenteeism in school and work is quite significant, not only for the individual, of course, and for the employer or for the school in the case of those institutions, but also in the context of the family who are trying to support that person. We all know that work of itself is therapeutic and also provides income, and we know that adequate income is one of the factors that supports good recovery in mental health. So if there's a high degree of absenteeism or indeed presenteeism, we tend to get a pattern where there's a denial of mental ill health and people are not aware of what's going on. And this is particularly important for employers, of course. And we do know from research that a significant number of people hide their mental ill health in the workplace for all sorts of fear related to stigma, prejudice, discrimination, and so on. So it is really, really a significant issue for families to try and support people in that context. We also know that poor education is a significant factor, and we've seen it in the documentation, and we've heard about it this morning. Generally speaking, the less educated you are, the more risk you have of sustained mental ill health and a poorer recovery. And families, of course, are part of that scenario in terms of trying to support and deal with those outcomes. Poverty we know well, and in a sense, COVID illustrated this in many parts of Europe, where people with less economic income, with lower standards of living generally, found it more difficult or responded more negatively to the trauma of COVID-19 and what happened and the subsequent fallout from that. In a sense, the way we look at it in mental ill health, the real disease here is poverty rather than specific labels. The poorer you are, the more impactful some serious mental ill health will have on you. So the lack of support, information, education and intervention by mental health services is the other main plank. We do know that services are well developed in terms of supporting individuals and inviting individuals to become a partner in the mental health recovery program. Very often families, not for malicious reasons, but more for unconscious forgetfulness almost, leave out family members. And we do know that family members have much to contribute. They know about what's happening in the person's life. They respond to crisis. They know the trigger factors. They know all sorts of things about the person that the service may not know. And we do support always a dialogue and a support system which involves the primary carer, the user of the service, and the clinical team who work with the individual. So, from our point of view, and I've said this at the start, we want to see very well developed mental health care services across the whole of Europe. We have now an imbalanced system ranging from excellent models of service to very, very poor models. For us, services must be efficient, obviously in terms of how they deliver services. They must be effective in terms of achieving outputs and outcomes, and we're very focused on outcomes, which is the benefit and quality that occurs to the person as a result of the intervention. It must be timely, and this is, we're very supportive of, for example, early intervention models and preventative models, whereby we try and deal with situations before they become worse, and before they become so difficult that they require much more intensive long-term interventions, and in fact sometimes may not allow for recovery to happen. And they must be localized. We must have services that are community-based in the local community where persons can access them. One of the barriers to access is that people don't have an immediate referral to a local service and that they must wait for a longer period of time. So, in a nutshell for us, good mental health care should involve individuals, should involve families, should be delivered to the right person at the right time and in the right place. Last one. Thank you very much.
Thank you so much. That was John Saunders of Youth and Me supporting families affected by mental ill health. I think what you highlighted there and what we'd like to highlight again is that this is something which really goes to the core of fundamental rights. And on that, I'd like to bring in Guadalupe Morales, who's the director of Fundación Mundo Bipolar in Spain. She joins us now via video link. Guadalupe, the floor is yours for 5 to 7 minutes. Guadalupe, I'll let you know when you have around 2 minutes left, if you don't mind, just as I'll come in on that. But for now, the floor is yours. Thank you so much for your time. We don't hear you yet.
It's you that have to give me the...
We hear you now.
Okay. So, good morning. I wish I was there. Thank you very much for the invitation. It has been a pleasure to be involved in Headway since 2017. I found the most efficient, respectful, and educated persons I ever met in my professional life. Elisa and Marta and Lady Clara ran the project smoothly, creating a good working atmosphere. This report is the result of a fruitful collaboration between the different sectors and collectives related to mental health, especially in Spain, my country, in which debates, discussions ended in consensus. Just to mention one aspect, the working group was open to accept crucial semantic changes and no longer say mental illness or mental ill person or person with a mental illness, but instead person with psychosocial or mental health problems, as well to highlighting the UN Convention for the Rights of Persons with Disabilities, the CRPD. I tried above all to make clear the importance of meaningful involvement of users and their organizations. This has come true. As Peter Campbell, a historical disability activist in the United Kingdom said, participation and participation that changes things are two different things. He created the slogan, "Nothing about us without us." Everybody seems to know what are human rights. But when it comes to mental health, it's not so clear. The approach to mental health must be done in the first place by the point of view of human rights. That we are entitled like holders of rights and not objects of care. This point is critical. I think that as long as the approach is not made from the point of view of human rights, we will be wasting our time, maybe our money, and acting against the legality and the historical evolution. If we approach the need of mental health as a medical, psychosocial rehabilitation, or just an economic issue, we will be wrong. I propose that we assume that we are living in a paradigm shift. Persons with disabilities are not viewed as objects of charity, medical treatment, and social protection, rather as holders of rights in the first place. Next slide, please. Our constant teaching on rights. This project is under the optic of articles of the Convention. For example, Article 19, living independent and being included in the community. Article 27, work and employment. Article 28, adequate standard of living and social protection. We could have added employment. In relation to employment and disability in Spain, we have good legislation. 2% of all jobs for people with disabilities have to be for them in companies that have more than 50 employers, but it doesn't happen, even in the public sector. Laws by themselves cannot change things. Of course, laws are absolutely necessary. I was very surprised and worried when I learned that a country in Eastern Europe, member of the EU, is not allowed to hire people with mental health problems because they have to ask permission to work from the general practitioner. And they never get it. They never give this permission. So this is a clear discrimination. I ask myself, if we had a strong users movement, could we fight against this? Next slide, please.
Just to say a couple of minutes more, Guadalupe Morales. Thank you.
I have prepared my presentation for 10 minutes, and it's 8 minutes. This pyramid amazes me. WHO states that the highest cost and less frequency of need are in long-stay facilities and specialist service, while self-care and informal community care, which are the most needed, are the opposite, have the lowest funding, even though they have the lowest costs. This is the case of peer support and trainings, self-help groups, associations, users movement, who are considered to be the most necessary, but we don't receive funding, almost no funding. In our report, it stated that Fundación Mundo Bipolar is pioneering peer-to-peer trainings. In Headway, we can read, the final report, it explained that a person affected by such circumstances with adequate training can learn to handle his condition by himself and become expert by experience. Learning among peers based to a large degree on empathy enables and promotes self-management at the same time a larger political and social consciousness. Next, please. I've been involved and still, I'm still involved in a Horizon 2020 research project called Recover-E. I train professionals, psychiatrists, psychologists, nurses, and social workers, as well as persons with lived experience, peers, that become peer workers after this training. Here I'm training in Romania. So from my point of view, peer-to-peer trainings and peer workers having a salary in conditions and working at the same level as their colleagues in the community mental health brings hope. I can tell you that there's hope. Please take us into account. We are the real protagonists. We have to be there. We have our own voice. We are very grateful for others to talk on our behalf, but there's no need for that. However, so many people continue to stay isolated, fearing themselves and not realizing the power hidden in their experiences and not realizing their rights. But unfortunately, still too much attention is still being paid to biochemical, biomedical solutions and too little to users-led initiative. We have demonstrated that specialized training courses for users and for professionals delivered by us are very much successful. We have made research on that. So, my conclusion on Headway 2023. There's a paradigm shift, again, a paradigm shift that sees individuals as active citizens and not as ill patients. Times are changing. Thank you very much. Nothing about us without us. I hope I've been in time.
Absolutely. Thank you so much. That's Guadalupe Morales of Fundación Mundial Bipolar in Spain. What a passionate intervention. We're so lucky to be joined in this room by people who I feel in other healthcare settings might seem generally quite clinical, if you don't mind the word, but what I see here is really passionate people that are genuinely so involved in their work. So thank you so much, Guadalupe Morales. I'd like to pass on now to Gemma Calamandrei. She's the director of the Italian Institute of Health, Behavioral Sciences and Mental Health Reference Center. She's also joining us via video conference, and we'd like to talk to her about some data on the Italian experience and how, as we've seen, the mental health problems seem to replicate and reflect existing inequalities in society. Gemma Calamandrei, over to you.
Hi, good morning to everybody, and thanks for this invitation. Hope you can hear me. Okay. Thanks.
I hear you fine.
So I prepared some slides. Can you show me? Can you show the slides, please? Yeah, just let me start with a quotation of a WHO definition of mental health that I think fit perfectly within the spirit of this Headway 2023 initiative. So placing emphasis on community and the role of social relationships in mental health and physiological well-being. Going straight to the point of the next slide, please. As for the mental health status of the Italian population, we are perfectly representatives of European means as burden of disease. And as you can see, we in Italy place the mental disorders place themselves in the fifth position. And so with the depression and anxiety with the maximal burden on disease. I want to just to stress here that sometimes calculating burden on disease, we should put more emphasis on the social determinants, socioeconomic context, and social determinants in general of mental health disorders, something that is done for cardiovascular disease, but not very much for mental health. This could help to reason in terms of community much more at the European level. As next slide, please. Yes, this is just to look at data in 2019, just before the pandemic, in more depth. In Italy, the prevalence of mental health services user show very strong regional differences and confirm that female are more impacted than males, and that depression is still the more frequent diagnosed disorders. And these differences in prevalence between regions, you know, Italy has a national health system based on regions, may possibly indicate different emphasis, different money put into services, but also differences in caring capacities, which is a problem for a national level response to mental health. Can I see the next slide, please? Okay, and this is I try to highlight in a Headway 2023 perspective, the responsiveness of the system to mental health needs. And Italy, on paper, has one of the more advanced system in mental health care system, I mean, and you know that the strengths of the system are well known, and following the entry into force of Law 118 in 1978, we abolished psychiatric hospitals, and the mental services became deeply rooted in the territory, in the local dimension. This means that the national mental health care system try to implement community-based intervention mainly on outpatients, and that we planned with laws, specific laws and regional organization, the integration among social and health services to favor a stepped care intervention, starting from the mild disorders to the more serious ones. But we have also an advanced legislation on job inclusion in Italy, and but we have a lot of weaknesses, because we can have the best system of the world, but if you don't put money on it and you don't adapt the system to a changing society, there is a problem. And really what we are experiencing in Italy well before the beginning of the pandemic, such as we assisted to a progressive reduction of economic and human resources to the services. And this means that we had experienced a significant reduction of psychosocial treatments in favor of pharmacological ones, and a reduction in care for early diagnosis and early intervention. And also on the side of the job inclusion, we must confess that we have a great weight of stigma, of bureaucratic burden, and also reduced investment to community-based projects. And they hinder social and job inclusion, because you have to support the network at the local community level. Next, please. This is just a very recent data from 2019, data from the Ministry of Health, showing that we experienced from 2015 to 2019 a progressive decrement of personnel assigned to the mental health departments at the national level, and with a reduction of per capita expenses to the structures. So next, please.
Just to say, we've a couple more minutes before we wrap up there.
Yeah. Just so not, or I'm trying, because I'm okay. Next, please. So I go. So what are the solutions, the possible solution we can suggest now? So of course, from the healthcare, for the point of view of the healthcare, just endowment or the adequate human and financial resources. I think this is true for every country, and especially true for Italy, which is a very, very diffused and well-designed system. And so the empowerment of family and users, the strengthening of psychosocial approaches with individual health budgets, for example, which is project giving autonomy and designing intervention and inclusion to specific needs of each person, and then trying the staff with a multidisciplinary idea with integration between health services but also social services. Next, please. And for the workplaces, I think that we have, this very wonderful law to include people with mental disorders, but we need to do two main things: just fighting the stigma, to promote integration, and these are a lot of we gave for granted that the territorial dimension of the mental health care fight the stigma. This is not true. We need to implement programs to explain people that a person with mental disorders can work and stay in the society, and doing things, practical things like a normal person. So, and implement the professional figures such as the therapists, occupational therapists. And as for children and adolescents, we know that we have to use school. We have seen the damage of school closure during the lockdown, during the pandemic, but you need to support young people and children in development of emotional cognitive strategies to cope with stress, to training in mental health, young children and adolescents at school, but also thinking about the society and intervene on lifestyles for young people, such as having a different relationship in our town, for example, with green areas, space, and physicality, to promote sociality and plasticity, adaptation and resilience to a stressful event, a stressful condition like the one we have just experienced. Just to finish, I think that in each country, the national recovery resilience plans present very good opportunities, because there are a lot of money placed on mental health and fragility and fragile people. So we need to try to work together in a European perspective, but using what we have. Just let me say, to conclude, that the National Recovery and Resilience Plan in Italy, mental health is never specifically mentioned. But this doesn't mean that we can use all the pillars, the one money assigned to the Ministry of Health, to the Ministry of Education, to the Ministry of Labour and Social Policies, to implement, to support the inclusion of people, their research on risk factors to activate prevention and promotion before care, before cure, and place specific focus on children and young people up to 25, because we can do a lot of work before and beyond the pandemic, because what the COVID-19 has taught us is that the local dimension, the territorial dimension, is fundamental to cope with the difficulties of people. And so we are possibly experiencing an increase of cases, especially in the mental general, in depression and anxiety. We have to prepare the system to cope with this impact and use all the money we have from Europe to work in concert and together. Thanks a lot.
Thank you so much. That was Gemma Calamandre, the director of the Italian Institute of Health's Behavioural Sciences and Mental Health Reference Centre. Thanks so much there at the end for also reminding us of some optimism that there are opportunities within the new recovery and resilience plans. And last in our roundtable, I'd love to pass over now to Raluca Nica. She's Vice President of Gamian Europe. That's the Global Alliance of Mental Illness Advocacy Networks. And Raluca will be talking about what needs to be done as we look toward a world and hope for a world post-COVID-19.
Thank you very much, first of all, for the invitation. I'm honored to participate in this Headway initiative, which seems a very strong and solid initiative that adds to the global efforts in mental health. As it was mentioned, I am speaking on behalf of GEMIAN Europe, which is an alliance of organizations dealing with psychiatric disorders. We have about 65 member organizations all over Europe. I just want to be brief. I think there were very many good and interesting presentations, and obviously almost all referred to the fact that COVID-19 took an enormous toll on people's mental health around the world. And unfortunately, this COVID-19 pandemic period affected pretty much the health of the population because we had many lockdowns in different countries and also restriction on freedoms, which made it difficult for people to work and participate in the society. And we can imagine that for people with mental health, it was even harder. Because not only they couldn't participate, that they were very much, most of them, dealing with their problems alone. And obviously we need to find some solutions so that we can support people to adapt in a normal COVID world. We don't know exactly, we do have some solutions now, we do have vaccines, but obviously we still are in a period which supposes many restrictions, and we have to see what we can offer to people so that they work and function in this COVID normal world. Obviously that there is a challenge on the delivery of mental health treatment and care because of the lockdowns and the restrictions, and all the strategies that we tried to employ rely heavily on timely and adequate response, and we have to recognize that this was not always the case in many of the countries because, well, definitely mental health is not always a priority in terms of funding. So what we need to do in order to meet the mental health needs, which are, as it was mentioned already, probably higher than ever, to strengthen the mental health governance of the systems, and also to have more availability to services and to virtual platforms, because if we think to what has been happening during the pandemic period, probably the virtual platforms were a kind of very easy solution to employ when we couldn't reach each other. Also, capacity building for service providers. But what we should not forget is that this capacity building has a limit. Nothing is endless in this world, and we do have limited services. So probably there is more than that, which deals with what we can do, each of us, in order to support also the system so that the system can still function. Of course, we should look more to the populations which are at the higher risk of developing mental health problems. And I'm referring here to children, to adolescents who have this problem of dropping out the school, but also to people who are from the socio and the economic sides of the society, which are not very fortunate. So we should have some strategies that meet the needs of these people. And the virtual interventions can be a solution, but still are not available, especially for the risk populations we are talking about. And we should orient more the capacity building toward protecting these people. but also to healthcare providers, because probably the number of the healthcare providers that use mental health services have increased enormously. Many of them presenting, burnout syndrome or anxiety disorders, depression, or even PTSD. In order to have, a better response of the health system, obviously we have to integrate the mental health and psychosocial support in the high-level mechanism guiding the response to COVID-19. And what people want was somehow outlined by a survey that was done in Australia. And what is interesting is that 46% of them want management of future pandemics, which somehow show a very human being aspect, namely the fact that we are not dealing very well with unpredictability of the world. And this is, half of the respondents almost, no matter of their gender or age or socioeconomic status, responded that they want a better management. Maybe we should work more on how to accept and to deal better with unpredictability of the world, because obviously we cannot respond to everything. And what we can do is to support programs that would teach these people how to get more comfort, as my colleague said from Spain. And this can be also found in the community. So use more the resources we have, the individual resources, but also the community organizations. And this is the message I have to pass on from my organization, DME in Europe. Thank you for the invitation again.
Thank you so much. That was Raluca Nika of Gamian Europe. So as we now enter this time of renewal, of rebuilding, of recovering, the Headway 2023 Mental Health Index can surely be seen as a useful tool for monitoring and planning for health, welfare and education policies when it comes to mental health across Europe. This today is an opportunity to be seized. What's going on at European level and what priorities have been laid out for the future? To talk about this and to draw our event towards its close, I'd like to call on Member of the European Parliament, Brando Benifei, who joins us now via video link from Strasbourg. Mr. Benifei is one of the Parliament's youngest members and is part of the MEP Mental Health Alliance, among other bodies. Mr. Benifei, the virtual floor is yours. I'll give you a 1 or 2 minute warning before we need to wrap up. We don't hear you yet. Let's try again. Unfortunately, not until now. Otherwise, we'll have to ask you to mime your entire speech. Looking at our technical corner there, yeah. These, again, the joys of these phygital events. What a shame that we've not been able to connect to Mr. Benifei until now. Does it look like we're going to get him back? Mr. Benifei, there, I see you again. Okay, let's try once more. It's a microphone issue at Mr. Benifei's side, as far as I understand. So I think what we'll do for now is, instead of waiting for Mr. Benify, hopefully we'll manage to join him in the meantime. I'd like just to bring in some of our speakers that are here in the room to extend a bit our roundtable and to perhaps engage in some debate, which we would have loved to have more time for. So what I'd like to do on this beautiful sunny October day is to ask you for your reasons to be optimistic. What are you taking away from this room that you feel is something that can be positive for the way forward? I'd like to first start with you, Mr. Saunders.
Hello? Can you hear me?
Well, I'm sorry, you've been upstaged. We can hear you loud and clear.
Okay, sorry, it's been a problem with me, with my computer of the telephone. I hope you're able to hear me. Yeah.
We hear you.
Okay. Even though this makeshift solution, I think you can hear from me. So thank you for your invitation to participate in the Mental Health Forum. We are busy here in Strasbourg, but I was happy to be able to listen anyway to some of the final interventions of the roundtable. The Headway initiative that was created with the Angelini and with European House Ambrosetti is for sure a key opportunity to raise awareness on the evolving of the concept of mental health through strategic thinking, analysis, dialogue with experts, and exchange of different European experiences. I think it's very important that we promote this kind of activity, especially in this moment when we are rediscussing all the boundaries at European level of these topics. And obviously, when we talk about mental health, we talk about a topic that goes beyond age, gender, social status, and origin. Mental disorders have an important impact not only on individuals and their families, but also as a society as a whole, for all the society, and not just in the healthcare field, clearly, but also in work environment, education, and local communities at large. The COVID-19 pandemic has further highlighted the important socioeconomic impacts of mental illness, underlining the crucial role of some determinants of mental health, where we live, study, work, and age influence our mental health and well-being. So it's very important to consider all these elements when we plan effective strategies of promotion, prevention, treatment, and rehabilitation of mental disorders. A survey conducted in April 2021 by Eurofound shown that the levels of anxiety and stress of the population have increased significantly since the start of the COVID-19 pandemic, for obvious reasons. Loss of family members, fear of contagion, lockdown measures, isolation, etc. And in all countries, mental well-being has reached its lowest level across all age groups since the onset of the pandemic. And as the consequences affect all, it's clear that we need different strategies when we look at the younger generations, at adults and elderly people, because they have different causes also for their distress. Clearly, the European Union has taken all these into account when it decided to take some decisions. For example, we decided to increase the amount of resources for the EU for Health program for the period 2021 to 2027. It's 9.4 billion euros this time, setting the pillars of a new public health strategy at European level. We heard also the President von der Leyen saying clearly that we need to have a more able capacity of immediate response in front of emergencies. This was one important point in a State of the Union address just a few weeks ago. And the European Parliament approved, I want to conclude on this point, approved a resolution, sorry, with a clear reference to the challenge of the mental health, asking for the development of a European action plan on mental health for the next 7 years that can go in parallel with the work of the new European funds that I mentioned and with the recovery and resilience plans at national level. At European level, in the Parliament, we also built this coalition for mental health and well-being, of which I'm a member, that wants to promote the awareness and the importance of the work in all dimensions for mental health. Despite the advances achieved in some member states, others are still lagging behind. It's very clear from the presentation of the mental health index of Headway 2023. So it's urgent to conclude, to reinforce our work on mental health in all policies. It needs to be an horizontal approach. We have tried to do it from the Parliament side, and we need the member states to be on board, because I think that it's clear that our citizens need, especially now, a special effort to deal with the increased need for mental health, removing stigma and talking explicitly at the need for a human right for mental health for everyone. Thank you very much for your work, and we will continue exchanging ideas and data and trying to advance our policy work, also thanks to your important effort. Thank you very much.
Thank you so much. That was Brando Benefei, Member of the European Parliament. Dear guests, it's now time to draw our event towards its close. So I'd like to invite for some closing remarks Gabriele Ghirlande to take the floor. Gabriele is Global Access and Value Chief at Angelini Pharma. Take it away, Gabriele.
Thank you, Chairwoman, and thank you, everyone. It's a pleasure to be here with you. Firstly, let me extend the greetings from Pierluigi Antonelli, which is Angelini Pharma CEO, who unfortunately couldn't be with us today. But I'm honored to be here in its place, and I'm honored to be here with you. I've been in the industry for over a decade now, and I've worked in several therapeutic areas. And what I learned is that, by definition, there is no patient which is more fragile than a psychiatric patient or a mental issues affected patient. And this has strengthened my determination to join Angelini and to work with Angelini towards finding, if not solutions, at least answers to the escalating mental health crisis that we're facing today. Headway 2023 index sets the stage, I would say, for improving mental health management in the European Union. And it also witnesses Angelini Pharma efforts and actual engagement to destigmatize mental disorders and to actually come closer to solutions. As many of the speakers, and I think Professor Arango, Professor Starace, but all the brilliant speakers that intervened today pointed out and confirmed clearly, a healthy and functional population is the cornerstone for an expanding economy and a prosperous society. I would have loved to say happy society, but then I thought to myself, it's actually happiness that defines a positive environment, a positive society. No, it's the ability to pursue happiness. And mental issues, mental health disorders are actually the bigger blocker to the ability of pursue happiness. Make no mistakes, anyways. I mean, Headway 2023 findings are alarming. They're not just reassuring. But I truly believe that has been said that evidence must drive action. And evidence-based action is actually the way to address a complex domain as health issues, and especially mental health issues. Headway 2023 can support governments and the productive parts of society and the institutions of the European Union, not only to fill the gaps, but to actually progress in the management of mental health care response system, including the evening of gender disparities in diagnose, treatment, and support. So this groundbreaking report marks a substantial step forward towards health and prosperous society, but the path is long. So I would invite everyone to see today not as the finishing line, but actually the next mile in a marathon that we are all running. Thank you very much.
Thank you so much to Gabriele Ghirlanda. You're quite right. This is a stepping stone in a very long journey. Before we go to our final close, I would just love to show you once again the link where you can download all the documents from this event. Would you be able to show us the slide, please? So there you are. All of today's documents can be downloaded at the link you see there. So, dear guests, it's time to close. All that remains is for me to express my heartfelt thanks to all our speakers and to everybody who made this event happen behind the scenes. Thank you for coming on this very interesting journey with us. I hope you go towards lunch, towards the rest of the day, towards the rest of your year and your careers with some food for thought, with more to mull over, and above all with a real sense and a drive for action and for change, as you all mentioned. My name is Rosie Birchard, and it's been my pleasure to chair this event for you. Thank you all.